Hi, this is Brenda Egan Brown from the BrainSTEPS program in Pennsylvania, and I'm here today to talk to you about the document that we have created that is used anytime that you are going to support a student who needs any kind of academic adjustments or informal supports. So this is called the BrainSTEPS Student Brain Injury Supports Framework. And this is what our team members take with them when they go into a meeting with the school, and it really helps guide the meeting. So, for instance, if you are going to attend a school meeting for a student following a concussion, this is the perfect document to take with you to the meeting, and it will help guide the meeting. So we created this annotated form to help guide the meeting for our newer team members, and as time goes on, you'll get the hang of this. It's really quite simple to use. So the first page of the framework has places so that everyone who's in attendance at the school meeting can put their information down. And then prior to the meeting ending, it's good if everyone sets a date and time for a 1-month follow-up meeting to be held. Now, what this framework does is it will walk you through all of the different kinds of symptoms that a student experiences following a brain injury, more specifically, especially concussions. So for the first one of this BrainSTEPS Brain Injury Supports Framework, it talks about physical changes. So headache or pressure in the head. And what you'll do is the student should always be in attendance at this meeting. And the school team's going to be there, hopefully, the CMT, and also the parents. So you'll ask the student, if the student says, yes, I'm having headaches since my brain injury, then you're going to want to know, what environment are these headaches occurring in? At home, at school, during what classes, during what time of day? Because that can also help guide what kind of accommodations or, informal academic adjustments you will want to put in place with the school team. So after the student tells you whether it's happening at home or school, then you're going to talk about what type of activity the student does and have they noticed a pattern that's triggering the onset of these headaches. Sometimes it could be reading, writing, the computer screen, lights, noise, and there's other triggers also. But these are here just to kind of help guide you to ask questions. So then you're going to ask the teachers, okay, have you been implementing anything for this student currently? And whatever they tell you, you will type in here. So maybe they are letting the student put head down on desk. So you would write that down. And then over here, what academic adjustments could you help the team put in place for this student that might help? So you could talk with the student, the school team. Maybe they would like the student to take breaks as needed, because you could let them know that, okay, so you're trying already by letting the student put their head down when he has a headache. But let's be proactive and try to stop the headache from even occurring by taking built-in breaks before they're needed. If so, you could type in your own, build breaks into the day. Maybe midpoint in the class, the student would just take a 5-minute, close their eyes, put their head down, little break. And so maybe they're going to do build breaks into the day. Let's take this one out. Maybe they can wear sunglasses or hat. Maybe that would help, because maybe light triggers their headache. Maybe they want to try short work period followed by a break. So there's all sorts of things here. But basically, whatever you don't want, whatever the team decides they don't want, you delete. Like that. And whatever they do want, or if there's something else you all come up with that's better, you add it here. So then the next physical change, which should really be on the next page, but I deleted a bunch. So the next page, we're going to go through light sensitivity, same thing. What environment is it occurring in? What type of triggers could be triggering light sensitivity? A lot of times we hear that a student will be sitting near the window and the sunlight bothers them. That triggers it. Computer screen can trigger it. The projector in a dark room, the LCD projector light could trigger it. So all of these triggers, you could talk with different triggers, and then based on what those triggers are, whether it's occurring at home or at school, you could talk about what kinds of academic supports may have already been tried, and you put them in here, right here. And then what kinds of supports the school could put in place, like sitting away from the windows, dimming the lights or turning off half the lights in the classroom, using colored filters for reading and doing worksheets. So what we did in Pennsylvania was our BrainSTEPS teams have been using this document, the Brain Injury Support Framework, for years now. And we tweak it all the time. And they add to the bank of different kinds of supports as, they come up over time. So it's really a great tool to help guide your meeting, and it will help you feel confident when you go into a meeting with a school team because it just guides you right through it. So then you ask the student, okay, are you dizzy or lightheaded? Same thing. Other physical changes, they're all listed out here. I'm not going to go through each of them, but you get the hint. You just do the same type of thing for each one. And, they might not have a lot of these symptoms. If not, delete them. Keep on moving. So once we get through the physical symptoms, then you get to the thinking and learning changes. Same deal. Confused or in a fog, mixes up time or place, lower attention and concentration, inattentive. Maybe this student has that. So we're going to talk about the same thing. What's the environment? What are the triggers? What kinds of supports are the teachers using now in the classroom, and what could they try in the future that we know works for these kinds of issues? Here are some other thinking and learning changes: difficulty with memory and a lot of resources. As you can see, it's very, very easy to use this form. And it's very comprehensive. So it really gets to all the issues that you're going to encounter or could encounter. Also here, then we transition to behavioral and social changes. So restless or irritable, anxious or nervous. This is used a lot by our teams, and also sad, depressed mood swings. So we have a lot of relaxation tips here that teachers could employ, and the parents can also use in the home setting. And then as we go down, some of them you might need to add your own in, but it's a working document which your team can customize to their team, your own team's needs. And then once you go through all of the different kinds of symptoms, you can talk about any background information. So any pre-existing diagnoses, conditions. So maybe this student has a history of multiple concussions, and a history of ADHD. And that's important to know because that history of things could, having a history such as this could very well prolong recovery. Then present at the meeting, we already had that on the first page, so we can actually delete that. Current school situation. So is the student attending school full days, partial days, homebound, hopefully not homebound, but etc. So you could talk about that here. Maybe the student's back at school half days for the first week, and then they're going to transition to full days or whatever. But typically we won't be working with the student, that first 4 to 6 weeks. So this document is used when you go into a meeting with the school, usually for a concussed student, at between 4 to 6 weeks. What medications are currently being taken, any follow-up appointments, so which professional and when. Maybe they're going for vestibular therapy, maybe the student's being evaluated for an ocular dysfunction issue. Any other therapies like speech language, and then any additional notes. And on the next page, so for the student and family to do for the next session. So for instance, or when we meet again in a month, maybe the family is going to weekly at home fill out one time per week the symptom checklist. And then they could share that with the school and with the medical provider if there is one. And hopefully at this point in time, there would be one. And then for the school to do. So they will continue monitoring academics and symptoms. They will continue to update the BrainSTEPS team member point person. They may also facilitate the next meeting in 1 month. So again, this is just a place for you to take notes, not really take notes, but establish who's doing what within the next month before you meet again. And then you're finished. And what you have is this nice living document, but we never give this out in Word document format. So this is a BrainSTEPS document. Only BrainSTEPS team members use this. So before you turn it into a school, you're going to want to go up and you're going to want to save as, and you have to save it as a PDF format before you send it to the school. And then I'll export it and it will save. So that is because it needs to be in a PDF format so that no one changes it. So this is a document you'll send to the school, and then the school should send it to the parents and all the teachers. That's very important.